Hi students, welcome to the part 2 session of ICU services which is belonging to operations planning IP services for MBA first year first semester. Okay. Now, let us move on to see what are the different types of ICUs based upon the location. Okay. So, ICUs based upon the locations that where they are situated, the ICUs can be divided into two types. Inside ICU, that means ICUs situated within the hospital premises, and outside ICUs which are not situated within the hospital premises. So, the ICUs which are situated within the hospital, like we have seen different types of ICUs, ICU, ICCU, SICU, like NICU, these are all the ICUs with the sophisticated equipment, trained staff, trained professionals, all are having establishments within the hospital where they are closely attached to the inpatient wards. Okay. The outside ICU is nothing but an ambulance or ICU on wheels, where while transporting any critical care patients, critically ill patients or patients who are having life threatening conditions. So, these patients needs to be taken care right from the source where they are being picked up. So, for this the ambulances are equipped with different advanced life support systems, different equipment to take care of the patient all through the way to the hospital, so that to save the life of the patient. So, this is an ambulance capable of providing the all the critical life support that is available, that is required for the patient during the transport phase, okay, during the transition phase from the source or from the location of the patient to shifting the patient to the hospital. Okay. Now, what are the different levels of ICU care? So, when a patient is admitted into ICU, what are the different types of care that the providers or the staff can provide to the patients? Okay. So, level 1 care provides monitoring, observation and short term ventilation, like the patient is not so critically ill, but there is some threatening condition to the life. So, the patient is put into the ICU, provides, the providers have the monitoring capability, they do some monitoring and observe the condition of the patient, and if required put the patient on ventilation for a shorter duration. Once the patient recovers, then the patient is out of the ventilation, and then plan for the movement of the patient to other care areas. The next, coming to the level 2, so the monitoring, observation and long term ventilation with resident doctor. So, a doctor has to be available within the ICU 24/7 to monitor the patient for a longer duration, understand the patient condition regularly, time to time on a specific periods, and take a decision on change the treatment plans, provide different kinds of services required. So, all these things will be the level 2 care, where a prolonged observation and prolonged ventilation is required and under supervision of a doctor. Okay. Level 3 care, it contains all the invasive hemodynamic monitoring and dialysis and different support services within the ICUs, like all very critically ill patients who needs to have all the life support system to be provided, otherwise they will not sustain their life, and patients who requires continuous monitoring, regular observations by doctors. All these types of patients are put into level 3 care with support services like dialysis and other diagnostic services. Okay. So, these are the different levels of ICU care. Now, let us see the ICU process flow, how a patient comes into the ICU, how a patient leaves the ICU, what is the entire process flow that is involved in treating the patients. So, the patients can come from anywhere in the hospital, right from the inpatient ward or maybe a outpatient ward or from an emergency department. Like emergency department is a place where patients come during emergency conditions, they get stabilized there, and then basing upon the patient condition, the patient is transferred to ICU. So, where the intensive care, still a lot of observation, a lot of monitoring is required for the patient. Such patients are moved to ICU from emergency department, or patients from outpatient department, like patient who comes for regular general checkup because of some problem and suddenly they develop a critical illness or some life threatening condition, which pushes the patient to need ICU services. So, these patients are immediately transferred to ICU and monitor. And patients who are already staying within the hospital, that inpatients, suddenly during their process of receiving care, they might develop certain critical conditions or life threatening conditions which requires the patient to be moved to an intensive care unit, and then all the required monitoring, observation, treatment, care is provided in the ICU. So, that is the reason even in ICU, inpatient departments we have mentioned that the inpatient wards are having a clear access to the ICUs or other diagnostic services. So, that is the reason it has to be planned accordingly. So, these are the sources where the patient can come to ICU from different areas of the hospital, or as we have seen, there is an ICU on wheels, like ambulance on wheels. So, patient somewhere outside the hospital has some critical condition, suddenly the patient is picked up by an ambulance with all the support or equipment, and then patient is directly moved into ICU for continuous monitoring, observation and treatment. So, these are the different sources. Now, what happens when the patient is into the ICU? So, once the patient is into the ICU, all the required critical care monitoring is given to the patient, and as we have discussed in the previous slide with levels of care in ICUs, the patient receives the required level of care, and once the patient is stable and the critical condition has been removed with the treatment and with the help of support and treatment and monitoring. So, this patient is then planned to move to a different care area in the hospital, or sometimes the patient can be directly discharged from an ICU to home. So, these are the different process flows. They are the different process flow, how the patient is coming into the ICU and how the patient leaves the ICU. So, again as we say discharge, again the regular billing process and everything happens. Okay. Now, moving on to the location of ICU. So, where are these ICUs located in the hospital? So, where should they be placed? Like we have IP services, we have seen that the ICU services have to be away from the main traffic area of the hospital, having full access to ICUs or OT complex or diagnostic services. So, similarly ICUs also should be in close proximity to OT complex. Why? Because these are again a critical service providers within the hospital. These are departments which provide critical services. So, they have to be in close proximity, like anything resulting out of operation theatre, some critical condition, the patient is put in ICU, or anything out of ICU, the patient developing a critical condition which needs some surgery, the patient can be immediately easily shifted to OT. So, these critical care areas are located in close proximity to each other, okay? And this location should be away from again the general traffic, okay? Should allow access control, and we cannot allow everyone to enter the ICUs like in the other care areas. So, ICU is fully restricted and they have to put an access control or for a only specified group of people to enter the ICUs, okay? And this can be centrally located as a ICU complex. There are different ICUs, like we have seen types of ICUs, a list of types of ICUs that was seen. So, all these ICUs can be centrally located, providing access to different care areas in one area, a cluster, and these can be called as ICU complex, like all ICU, MICU, SICU, NICU, all can be placed in one cluster in one center called the ICU complex, okay? Or this can also be decentralized, like I have a OT complex especially for gynops in the 3rd floor. So, I have a gynops ICU or obstetric ICU in the 3rd floor close to the OT complex. So, this can also be decentralized depending upon the different specific departments or specialty departments, okay? We have a gynecology where severe gynec problems are dealt. So, any critical illness arising out of that, patients are put into gynec ICUs. Obstetrics, all deliveries, any obstetric critical conditions, once the deliveries are done and the baby is found critical, then the patient is put into the baby is put into the NICU. So, neonatal intensive care unit. So, like this we have different rooms, and any cardiology specialty having a cardiac problem, the patient is put into an ICCU where this is located in close proximity of the cardiac department. So, these are the different locations depending upon the areas, depending upon the specialities, the ICUs can be clustered or decentralized. Okay. Now, size of the ICU. So, the size of the ICU, what is the size, how the beds availability space and all. So, let us see, every bed has to have 12 to 25 square meter per bed, area of 12 to 25 meters, okay, and clear space around the bed. So, the space around the bed has to be clear and enough space should be there. This is because to allocate the providers to come and treat the patient in case of critical condition, or maybe use that space to put on some critical advanced life support systems or equipments and provide the care for the patient. Okay. And a minimum of 2-meter distance should be kept between two beds as per the NABS standard. So, in ICU, the distance between two beds should be at least 2 meters, so that the space is ample for providing the service. Okay. And a 1.2 feet head wall width should be available, like the beds have to be placed at least 1.2 feet away from the wall where the patient head is put on the bed. Okay. And the total area of ICU should be 2.5 to 3 times the total space of the ICU beds. Okay. Which includes again the supply and service corridor, the passageway, and of which is of 2.4 meter width. So, the entire ICU should be 2.5 to 3 times of the total bed occupied area. Okay. So, which covers which can be including the passageway and the corridor path and all. Okay. Okay. Thank you students for listening the part 2 session.